You're watching ABC4 News.
Healthcare providers want to bring attention to a rare but serious complication that can happen in young COVID-19 patients. Intermountain Primary Children's Hospital wants parents to know about the condition called MIS-C, and they have launched a study of it. ABC4's medical correspondent Saray Chin has the details.
We first talked about this study when it launched back in November. We want to update our viewers on how the music study is doing, specifically on MIS-C young patients. We have Dr. Nun Trong with the U of U Health and Intermountain Primary Children's Hospital to give that update, because I know that Primary Children's Hospital has more patients since November.
Correct. Since then, currently we've treated over 50 patients with MIS-C at Primary Children's at this point, and we expect the numbers to continue to grow after the holidays.
Remind our viewers what exactly is MIS-C and how it's related to COVID-19.
So MIS-C stands for multisystem inflammatory syndrome in children associated with COVID-19, and we think it's the child's immune response to the virus itself that leads to overwhelming inflammation that can affect multiple organ systems within the body, including the heart, lungs, brain, blood systems, so really any organ system. And kids can be pretty sick when they present.
Very sick. In fact, you have one patient that you're treating. Her name is Madeline. We have permission to talk about her case, but it's one of those where you have COVID-19, but parents don't realize how severe it can be.
Correct. So Maddie was pretty sick, and parents were surprised when we told them that she had evidence of previous COVID infection, as she had antibodies. But she had never had symptoms of a COVID-19 infection, no known exposures to COVID-19. And so it was a real surprise for them. Also, just how quickly she got sick, as it was pretty quickly with the symptoms that developed.
Dr. Trong, explain this 5-year study now, because there's so much that is coming out with COVID-19, but specifically in children. And you have dubbed this the music study. A 5-year study, what are you looking for?
So we're looking to see how organ systems are involved, when the symptoms start to resolve over time, and kids develop new symptoms over time. For instance, like in adults, we're starting to hear more about these sort of long COVID type patients who might develop chronic fatigue or other symptoms. We don't know if that happens in kids with MIS-C. And so we'll follow them long term to kind of see what organ systems involved, how long they're involved for, and when are kids starting to feel normal again, and if anything else develops over time.
The hope is to reach 600 patients, study them. When it comes to Maddie, if you really quickly just describe some of her symptoms.
She had fevers, which is one of the hallmarks of MIS-C, red eyes, she had rash, and overall just wasn't feeling well. And one morning she just had a lot of pain and couldn't move her body. But the symptoms can be abdominal symptoms, vomiting, diarrhea.
If folks would like to learn more about the music study, again, it's a long-term looking at this disease and this disorder in children and the impact of COVID-19. Please go to intermountainhealthcare.org for more information. Thank you so much, Dr. Trong.
Thanks for having me.
Coming up, is